All right, welcome, welcome, welcome. Glad that you're here. Glad you're able to make it. And to those that are watching on the replay, I'm glad you're able to listen and able to hear what I'm going to be covering with you today. All right, so we're going to talk about what's the best way to prepare / study for the NCLEX exam. And I did have a PDF that I created, which goes over a lot of the stuff some of the stuff I went over today, that I'm going to go over today, and more. So make sure that you download that. I just sent it out an hour ago via email. So if you have not downloaded it yet, don't panic. Just check your email, check your spam. It's also in the Facebook group as well. So you can also download it that way. Okay, so let's go right into the subject today, and let us talk about the best way to prepare for the NCLEX, or the best way to study for the NCLEX. First, what I'm going to say is that there is no, honestly, complete total blueprint to studying, because it is going to depend on your own personal history and background and experience, meaning that what works for one person may not necessarily work for somebody else. But what I hope to do is at least provide you with not just the guidance, the tips, but then also what you need to demonstrate and what is the level of competency you want to arrive at, which will indicate you're ready to take your NCLEX exam. All right, so let's go ahead and go right into it. First, I want to talk about why this is important. Why is a plan so important? Why can't we just go straight into talking about content? The reality is that there is only so much time in a day, right? And I'm sure for your situation, or wherever you may be in your journey right now, you may have other things that you have to accomplish, right? You may have other priorities that's not limited to the NCLEX exam. And I know for some people, some people can do this where they decide to take time off of work and just focus on the test, which I think is wonderful. And usually the people that can do that are maybe people who are married, so they have, the spouse can work during that time. So there's different priorities that you may have. You may have children, you may have other things going on. And because of that reason, you have to create a study plan. A study plan is like creating a budget for your time, and by creating a budget of your time, you're more likely to be consistent, and you're more likely to see results. And so I'm going to give you several different approaches that you may or may not already be trying right now in your routine, or that you may be missing. And what I want you to do is I want you to take notes, and I want you to identify what you need to add in your current study practice, your current studying method, to be more effective and to be more prepared for the test. So the first thing is that you got to give yourself an appropriate timeline. Okay, you need to give yourself an appropriate timeline. Now, inside the download that I just sent, I gave there's a table in there where I show you the different timelines based on your history. So I'm going to say what it is in the download, and then when you look at the download, you'll see it yourself. So a recent graduate, I recommend, right? And this is all if you. The first one is based on if you went through a good nursing program. Okay, a recent graduate, which is less than 6 months ago, you would be ideal to take your exam within 4 to 6 weeks. Okay, graduated less than 1 year ago, 1 to 2 months. Graduated 1+ year ago, 2 to 3 months. Graduated 2+ years ago, 3 to 6 months. And then an international graduate, 6 months or higher. Okay, so once again, if you want to know where I'm saying this from, download the PDF guide. It's in the Facebook group. If you're not using Facebook, just check your email. I sent it about an hour ago, or check your spam, and in there it gives you the list. It's about 6 pages long. All right, okay. So the first thing is, like I said, you need to give yourself an adequate amount of time to prepare for your exam. If you try to rush the process, you're going to feel inadequate. I remember when I took my exam, I prepared. You know, I went through a lot of practicing and studying, and I went through a great program, but I still didn't feel prepared because of the weight of the test. So, and imagine if you are somebody where you meet the other types of parts of the table, then, and you're rushing, like you're saying, okay, I want to take it in like a month, or, you know, then you may be setting yourself up for disappointment. So I say this with humility. Give yourself adequate time. And the numbers or the timeline that I put in the table is based on my experience with other graduates that passed their exam after failing before. Okay, so it's not just numbers I just made up randomly or Googled. It's actually based on my experience. So for example, we had one nurse. She was an international graduate. She graduated in the Philippines. She prepared for her exam in about 5 months. You know, we used her material, and then she passed after 8 years. And she was not the only one. Like we have several international students that on average they pass when they give at least 6 months or longer. And then I had other students. I remember I had one person, this was in 2017 or 2016, and she passed, and she had graduated 3 years ago, and she passed after studying within like 3 months. So I would recommend that you follow the timeline that I'm giving you in order to give you the best results. And the starting point is the time that you said, I'm going to be consistent. I'm going to focus. I'm going to really give my all. The timeline does not start the last time you took your exam. Even if you just recently took it and didn't pass, the timeline starts from the time that you said, okay, I'm going to focus now and start studying, you know, to take it the next time or to take it the first time. That's when the timeline begins. Okay, so that's the first thing. Start with the timeline. So what I want you to do right now, as I'm talking, is I want you to go ahead and on your piece of paper, your notebook, write down what that is for you. All right, write down what that is for you. Once again, let me say it one more time if you missed it. Recent graduate, 4 to 6 weeks. You graduated less than a year ago, 1 to 2 months. You graduated 1+ year ago, 2 to 3 months. You graduated 2+ or more years ago, 3 to 6 months, and you're an international graduate 6 months or higher. All right, so what I want you to do right now, I want you to write down what month that is for you then, based on what I just said right now. What month, what time period is that going to be for you? Even if you have not scheduled a test date, even if you don't have your ATT score, whatever it is, I want you to still write down a month and then aim towards it. So maybe it's March of 2020. Maybe it's February of 2020. Maybe it is at the end of this year, right? Maybe it's not until April, right? So just pick a date right now or like a time frame. All right, the next thing, number 3, I talk about this a lot in the PDF, is start with your weak areas. Okay, so we're not all weak in the same thing, and for that reason, you should start with your weak areas. Here's the order that I would say this though. Start with your weak areas in the order of the categories that's most concentrated on the exam. So, for example, the most concentrated parts of the exam, number 1, is management of care. All right, so meaning that management of care, I'm putting this in the comments. All right, management of care it is the highest concentrated category on the test. Okay, so meaning that it covers 20% of the exam, so it's the highest one. Number 2 is then pharmacology. All right, so this is the concentration of how heavy it is. not necessarily the order that I recommend that you study in. Okay, I'm just giving you the stats. Number 2 is pharmacology, right? So the second heaviest concentration of the exam is pharm. And then number 3 is physiological adaptation. Okay, so those are the top 3 highest concentrated categories of the exam. And this information, you can find this information on the ncsbn.org, their site, because they literally list out like in the test plan which ones have the highest concentration. So let's say, for example, if we go through, if you identify your weak areas, and your weak areas were pharm, right? And then your next weak area was safety, and then your other weak area was psych. You would start with your weak areas first, based on the ones that's most concentrated on the exam. So if you're weak in pharm and safety and psych, you start with pharm first, because pharm is the second highest weak area of the test. And then you would go to, I believe, safety, and then psych would be last, because psych is the least concentrated area on the exam. So you should give more time and attention to those areas that you're weaker in, and then less time and attention, right, to those areas that you're not as weak in. So this is how you're creating balance. So a really quick practical example of this: if I was preparing for my exam in 3 months, and one of my weak areas was pharmacology, and I'm reviewing the content in the program in the order that's in the program, because that's the best order to learn in, I would spend more time in the weeks or the categories that I'm weaker in and that has the highest concentration. So in the program, it starts out with physio, health promotion maintenance, then pharm, then I believe after that one is then safety. Oh no, sorry, I'll take it back. Physio, then it's health promotion and maintenance, then it's pharm, then it's safety, and etc. So what I would do is that if I know I'm weak in pharm, I would give myself 3 weeks or 3 to 4 weeks reviewing and going through over and over again the content in week 3 or week 2 of the program. I would spend more time reviewing that area. So I may go through, like in the homestay program, I may go through week 1 in just 1 week and just complete it in 1 week. Second week, I would, because that's my weak area, I would spend 2 to 3 weeks. So you give yourself more time based on the areas that you are performing the lowest in. Because when you take the test is going to present a lot of material of those categories that you're weak in. So you need to be well-rounded. That's why when you take the test, you're going to get, near passing, below passing, all that kind of stuff. Above passing, it's giving you those results based on the areas that you're more balanced in, or based on the areas that you're low in. So whatever your weaknesses are, give more time to that, and give more time to the ones that are more concentrated on the test. Okay, the next then is create a list. All right, create a list. All right, create a list of all the content you need to review, and then add quiz and practice question checkpoints. All right, so you're creating a list of all the content you need to review, and then you add quiz or practice question checkpoints. So for example, okay, I need to go through maternal health. So you're going to spend a week or maybe 2 weeks going through maternal health, and then now you supplement it with questions, and then you move on to pediatric health, and now you supplement it with questions. So fortunately, the way I created the home study program, it's already set up that way, where every time you go through a new category, you take a quiz. I would encourage you to do more questions on top of the quizzes in the program, right? So especially if it's a weak area, all right? So I would encourage you, like that would be beneficial. And I'm going to show you the reason why when I talk about the next tip or the next thing. But it makes a huge difference with your confidence. It makes a huge difference with your confidence and your ability to retain the material. The biggest thing that you need between now and your NCLEX test date is retention. That's the biggest thing you need. You need retention. So you have to formulate, or you have to identify different ways to improve your retention skills. And this is why a lot of people don't necessarily do very well, because of poor retention. So they are putting in the time to study, but it's being coupled with, you know, work and kids and noise and, you know, just so many different things is pulling your attention while you're studying. That's why it does help to, you know, go to a more quiet place like your library or something when you are studying. So you need to create an environment, or you need to implement practices that increases your retention. And I'm going to give you some examples of, you know, of what that would look like. But retention is your focus. How can I learn this better? How can I retain this faster? How can this click for me? You know, how can I make it so this clicks for me easily? How can I understand this in a way where it's easy to remember? How can I get to the point where, because I know it so well, I'm able to verbalize it? That is your goal, right? Is to retain. A lot of people study the information, but they tell me that the review, like a book or something, and then they forgot what they just studied, because the way they're doing it is not working. That's why it's good to have a study group, at least one that's dedicated, or a study partner, because the environment, the experience is memorable, right? Because you remember when you're taking your test, you remember how you were sitting across with your friend or something, and he or she was talking about different types of drugs that prevent bleeding, right? It's more memorable, the experience. Okay, but like I said, I'm going to give you some more examples. So write that down. One of your focuses is retention, and that's what I'm trying to do in this environment too, is also help to improve your retention skills. So here's different ways to create that retention. Consistency, repetition, and reinforcement. All right, consistency, repetition, and reinforcement. So in order to succeed, you need to be consistent, right, in preparing, right, meaning no weeks off, right? You need to implement as much ways to repeat what you're learning. This is why I recommend flashcards or audios. So for example, okay, because research shows that you have to listen to something 7 times before it registers and it really clicks. So here's what I would do, and this is what I did when I was trying to learn something new. And I was really serious because I knew what the end goal that I wanted. First and foremost, I would start off by taking some type of, I would start by just learning the material simple, right? So I'll read a book, right? I would read about it in like a book or something. Then I would watch a video, right? So I would watch the video about whatever I just learned to help me click the dots. Then I would, while I'm watching the video, I would take notes, right? Then the notes that I took, I would put it on flashcards, right? Then after I put after that, then I would download the video, or I would get audios and I would listen to the audio while I'm driving, while I'm at the grocery store, while I'm doing whatever I'm doing, while I'm on a flight, whatever it is I know where I can get time, where I can maximize my time. That's what you want to do. You want to maximize your time. So something may be taking away your attention, like with your eyes, but maybe your ears are still available. Where can I maximize my time? How can I maximize my time? That is you look at all the time frames where you know your ears are still available. Maybe not driving that well. No, yeah, you can still drive, but as long as you don't have earbuds, right, while you're driving, right? So you want to maximize your time. And by me doing that, oh my goodness, I learned super duper fast. Super fast. That's why I know a lot of things, because I learned stuff in multiple different ways, and I maintain consistency. So I'll read it, I'll watch a video, I'll take notes while watching the video, I'll put the notes on flashcards, I'll listen to audios, and I'll just repeat the process over and over again. That's repetition. That's learning it in multiple ways. For flashcards, there's 2 resources that I recommend for flashcards. 2 resources. The first one is called Chegg Flashcards. All right, Chegg Flashcards. Let me see if I can find it. Show you what it looks like for those that are watching the video. And it's an app that you can download on your phone. Okay, so here's what it looks like. Let me put it on here. Okay, oopsie, let me put it like that. There we go, Chegg Flashcards. I like it. I've used it. Here's why I like it. Let me tell you why I like it. It's because you can add visuals on the flashcards, right? So for example, let's say, for example, you're adding a disease process, right? Like you're adding heart failure or you're adding gastritis. So you could add, and maybe you're adding the symptoms. Okay, so let's say we're learning, okay, let me give you a good example. Okay, diverticulosis, okay? Or diverticulitis, I should say, diverticulitis. So diverticulitis, the patho is that it's a condition where there's pouches. Literally, it's like these pouches in which are called diverticula in the stomach. So that's the reason why patients cannot eat certain foods, because foods will get trapped in that diverticula. When it becomes inflamed, then it becomes diverticulitis. And the symptoms are going to be pain, like abdominal pain, and then bleeding. So if I was learning that, I would get a flashcard. You can get a flashcard, you can make a flashcard, and then I would, for example, download the picture off of like a free, public pictures or something, and I would find a picture of somebody in abdominal pain, somebody that has stomach pain, and then I would literally add the photo. That's what I did when I had flashcards. I would add the photo. I did the process because when I did the process, I was more likely to remember it because I was the one looking for the abdominal pain pictures, looking up the symptoms, writing the patho. But once again, repetition, that helped me to remember the material better. So that's the thing I like about these flashcards, is that on one side you can put whatever the issue, what it is, and then on the other side you could put a picture of that disease, and that will help you or the symptoms, and that might help you, and that would help you to remember the material. The other thing I like about these flashcards is that you can create multiple decks. So you can create, like, maybe one deck is disease processes, and another deck could be, drugs, or you can organize the drugs into different, drug types. So Chegg flashcards is a great tool because you can add pictures. So if you're more of a visual person, then you may like the Chegg flashcards more. The other tool I recommend is called Quizlet. All right. Now Quizlet What's different is that I don't think you can add pictures with Quizlet, but you can still download it as an app and on your computer. So the advantage with Quizlet is that you can add, it can be audio, right? So you can listen to the audio. The other advantage with Quizlet is that you can download other people's flashcards. So because there's so much to know, right? It takes a long time to create, like 100,000 flashcards or something. So literally, you could sign up, and Quizlet is free. Both of these tools are free. You can sign up for Quizlet, and then you just Google Quizlet flashcards about heart diseases, Quizlet flashcards about medications, and then there's people who have made their cards available on the internet that will come up, and then you just add it to your deck, and then now you can play it, and now you can listen to their audio. It's a really, really great tool. So I would recommend Quizlet if you don't have time to write out the flashcards yourself, and you're more of an audio learner than you are a visual learner. Okay? Okay. So going back to what I was saying, so consistency, repetition, and then reinforcement. So so there's different things that help you to reinforce what you're learning. Reinforcement comes through practice questions, right? Oh, and then let me say this too as well about the flashcards. Flashcards are good too because you have to think about what's going to help me the most when I'm taking the actual NCLEX exam. What's going to help me the most when I'm taking the actual NCLEX exam? So, for example, for me personally, I'm a visual learner. That's why I like the Chegg one over the Quizlet. I still like the Quizlet, but I'm more visual. So when I'm taking tests, I have a photographic memory, so I'll use what I saw to help me to remember something. That's why I like that. But for you, I have other students that told me that what helped them when they were taking the test and they passed the test after failing before is what they remembered that they heard. It's like they heard it again while they were taking the test. So you have to be thinking as well, what's going to help me the most when I'm taking the actual exam? And then, like I said, reinforcement. So reinforcement comes through doing practice questions. The reason why some people have it wrong is because they're only reinforcing. They're not necessarily adding repetition or learning new information. So reinforcement is, I learn the information, then I take a quiz. I learn the information, then I do more questions. I learn, like you're reinforcing it over and over again, so that way you create, here it is, a foundation. One that is fortified and that cannot be easily broken. So you need to do a combination, and that's what people miss or do wrong, is that they're only doing one-sided things. Here's a comment that I hear all the time to people who told me that they did not pass their exam. Okay, tell me, what did you do? Okay, the first time I just graduated from nursing school and I took my exam maybe about 4 to 6 weeks later, right? But I didn't really prepare that much. I just did a bunch of questions, did not pass their exam. Then they got discouraged. They took 6 months off, but this time they said, okay, I'm gonna just focus on content. They did a bunch of content, did not pass their exam. And now they get all discouraged and now they don't want to do it anymore. When they should have created different patterns to reinforce what they're learning, so that way they would be more likely to pass their exam. So you want to reinforce what you're learning. That will increase your confidence in the material, and that will increase your ability to understand what the question is really asking you. All right, what the question is really asking you, because the NCLEX questions are not tricky. It really is just trying to identify if you understand the bigger picture. And you can't do that if you only are looking at one side of it. That's why you need to do both. Content, reinforce. Content, reinforce. Here's the next thing. Diagrams, tables, and visual aids. All right, diagrams, tables, and visual aids. So this I love. This I'm huge on diagrams, okay? I'm huge on diagrams, huge on tables, huge on visual aids. So so once again, it goes back to repetition, learning the material but in different ways. So a diagram would look like, okay, let me see. Oh, I don't have my thing in front of me. A diagram would look like creating some type of chart or something that helps you to connect the dots. You know, if you are somebody where you need to see the picture or you need to see the connections, this may be a stronger method for you. And you can honestly use all of these. You don't have to just limit to just one thing. But a diagram is something that helps to connect the pictures where there's a shape. This is why I will often describe like drugs, or I'll just I use a level up approach. So for example, when I'm talking about medications, and you'll see this when you get to pharmacology in the videos, but when I'm talking about medications, I will show it to you in like a upside down triangle. So where the top is the drug classification, then the next one is the route, then the next one is the side effects. All right, so for example, it would be, oh sorry, classification, drug example, route, and then side effects. So for example, fluoroquinolines at the top, and then after that, Levaquin, and then after that, PO or IV, and then after that, the side effects, I'm trying to remember, like, oh, GI, upset stomach, and then I believe I want to say like neural conditions or some type, or like seizures or something. So what a diagram does is that it helps you to condense the information into one place, right? So that way it makes it easier for you to connect the dots. So let me see if I can. I'm gonna see if I can pull up. What I'll do after this video is over, I'll post a picture so you can see what I'm talking about. But diagrams, it helps you condense the information into one place. Same thing with tables. Okay, tables is as well another method that helps you to condense the information into one place. So let me pull up a table to show you. Oh, here we go. Okay. So, and this is probably going to be, it's going to be backwards actually, I think, on here, on the video. But just to show you what it looks like in this book, let me put it like this. Okay, see how, so this is a table, and just to explain what it says on it, it broke it down to assessment, the first column, then goal, and then management. So tables, and this is talking about anxiety, like how do we manage nursing anxiety. So you know how the NCLEX or the content, it's a lot of information to know. Tables helps you to condense it, right? Tables help you to break it down. And this is I talked about this. This is the same book I talked about yesterday, Illustrated NCLEX RN Study Guide. But tables is a good practice or good method to help to condense information and help you to memorize information. Okay, is using tables. The other one I mentioned is visual aids. So I love visual aids. That's why I try to use several visual aids in the video trainings. Visual aids, for me, I could read something all day long. I could read it all day long, but until I actually see what it looks like, then it makes a huge difference with my ability to really understand it, So for some of you, what may help you is to see the disease process and then look at look at pictures that reinforce it. Let me see if I can, oh, here's a picture I want to show you. And pull this one here. And this is, I put this picture in the videos too, but I just want to show it again right now. This is a video. It's on here. Okay. All right. Bring this up closer. Like put it like, oh. Okay, there we go. So this is showing you a picture. I'm gonna say, okay, yeah. This is showing you a picture. Put it like that. Okay. This is a picture of diverticulosis versus diverticulitis. So it's showing you a contrast image of what somebody who have diverticulosis looks like versus diverticulitis. When you see that, it helps to connect the dots versus me just explaining its pouches, right? So visual aids is a very strong method to help to reinforce what you're learning. And like I mentioned in the videos, I go over, I show different visual aids, right? But if at any time you're learning something new and you want to see what it looks like, Google the picture, look to see what it looks like. There was somebody that asked me, can you show me a picture of what Cushing's disease looks like, right? Because I talked about how Cushing's disease, it's a problem where, the patient has like a moon face, they're more rounded, they have purple stretchy marks on their skin, right? So they're more rounded at the top, but then their legs are usually more thinner at the bottom. So when they saw the picture, they helped them to connect the dots. So add visual aids in with your study plan. It makes another difference. Here's the next thing, okay? Hopefully what I'm saying is, hopefully I'm not talking too fast. If I am, I'm sorry. I'll try and slow down, okay, if I'm talking too fast. Let me do a recap of what I went over so far. Okay, so I talked about give yourself an appropriate timeline, and I went over what that looks like in a table. I talked about starting with your weak areas first and how. I talked about to create a list of all the content you need to know and reinforce it with quizzes and question checkpoints, which is already created for you in the 3.0 program. Then I talked about consistency, repetition, and reinforcement. Okay? And I just explaining what those are and what it means. And then I also gave some reference to different flashcards. Then I talked about diagrams, tables, and visual aids. All right, here's the next thing. Okay, this is the next thing. This is the next one. This one is study the differences. Okay, study the differences. One of the best ways to study this material, and once again for it to click, is to look at the differences. So when you're gonna get what? SATA questions. You're gonna get priority questions. You're gonna get different types of questions on the test. And they're each gonna present different answer choices. Many of those answer choices are actually referring to the disease process or the condition that's the exact opposite. But it wants to see if you know the difference. So let me give you an example, all right? Guillain-Barré disease and multiple sclerosis are very similar, right? I would say Guillain-Barré disease or multiple sclerosis, very similar. Here's why. Guillain-Barré disease is a condition of progressive muscle deterioration, right? And it is neurological, right? So meaning that over time, the patient can experience more and more degenerative muscle weakness to the point where the muscles in their lungs also degenerate, which is why a lot of patients who have like an advanced stage of Guillain-Barré disease, they need to be on a mechanical ventilation because now their muscles have weakened so much that they can't breathe on their own. Now, with multiple sclerosis, it's also a degenerative muscular disease. It's also a condition where over time, the patient can degenerate to the point where they can't move their limbs and they can't breathe on their own. But here's the difference though. So if I'm reading, and here's the thing, you don't know, let me say it like this, you do not study differences, okay? You do not study differences based on the signs and symptoms. You study differences based on the pathophysiology, okay? If you try to study the difference between the two diseases solely on the signs and symptoms, you're more likely to forget it. You're more likely to forget it and you're less likely to retain it. You have to study based on the patho, okay? So for example, like I said, Guillain-Barré and multiple sclerosis, same signs and symptoms, but different patho. Guillain-Barré can be triggered by receiving some immunizations. Rare, but it can happen. It can be triggered through a patient who has a history of the flu. It can be triggered by patients who have history of that they're allergic to eggs and shellfish. However, though, multiple sclerosis is more environmental and genetic. And with multiple sclerosis, unfortunately, we don't have a lot of information on why patients have MS. Same signs and symptoms, but totally different pathophysiology, totally different causes. So if I'm taking the NCLEX exam and I see a question on the NCLEX exam, the question on the NCLEX exam is going to describe a situation and describe the signs and symptoms, and it's going to expect me to identify what this disease is and what is the intervention. So if I only memorize the signs and symptoms, I'm not going to realize that it's actually talking about Guillain-Barré and not MS. That is going to make, if you hear what I'm saying, I promise you, you will learn disease processes left and right. Because the biggest thing about the exam is that you have to be able to divide. You have to be able to see the connection, but also divide things too. Meaning that you have to see how this belongs to this, but this does not belong to this. You have to see how it's separate as much as how it's the same. So same thing as well. Diverticulosis versus diverticulitis. Diverticulosis is chronic. Diverticulitis is acute. Same disease, but it has different, with this one actually has different signs and symptoms, and there's a different cause. There's a difference though. This is how you want to study, because what people do when they're studying, this is how they study. Okay, diverticulosis. Okay, signs and symptoms. So you read the signs and symptoms, you read the risk factors, you read the interventions, you read the treatment, and then you move on to the next one. Okay, diverticulitis. Then you read that, highlight stuff, right? Then you move on to gastritis. Then you read that, highlight that. Then you move on to Crohn's disease. Then you read that, highlight that, and that's how you study for like 4 hours. But you did not examine, okay, what's the difference between gastritis versus Crohn's? What's the difference between diverticulosis versus diverticulitis? You did not look at the contrast. You have to look at the contrast because that is where you're going to be tested on the most on the exam through SATA questions, right? Because SATA questions, a lot of them are simply like this. Which of the following describes diverticulosis? So that's all that apply. Which of the following would be the correct interventions for diverticulitis? So that's all that apply. Different interventions because it's not the same diagnosis. But it sounds similar though. And that is why when you take the test, some people will say, oh, I'm going back and forth. I'm not sure if it's this one or that one. And they have problems with limiting the choices, right? And they doubt themselves. It's because of the way you studied. You were not looking at the contrast and the differences while you were studying. So that's one thing I would really implore you to do. If there's anything that you can take away from what I said today, is you got to look at the differences. And what people do is that they don't realize or they're not anticipating that there's different levels to the same thing. Okay? There's different levels, oh my gosh, to the same thing. That's what throws people off. I'll see people who said, I took the exam and they knew about diabetes. They read diabetes, but it's like they didn't know what they were talking about on the test because there was different levels of the same thing. Even in this book right here, I just showed you right here in this book. This is talking about, I know you can't see the text, but I'm just giving you an explanation. See, it's like you see that it's a table, right? Okay, so even in this book, right? Even in this book, this is talk about different levels of anxiety. Mild anxiety, increased alertness, motivation, attentiveness. Moderate anxiety, perception is narrowed, selective inattention. Severe anxiety, behavior becomes automatic. Panic anxiety, patient is overwhelmed, inability to function or communicate. Same thing, but different levels. You gotta pay attention to the levels. You gotta pay attention to the different stages. That stuff matters. If the question says you have a patient and they're complaining of a headache and their blood pressure is 182/90, which of the following interventions would the nurse do first? Well, the answer for that question is going to be different if it says their blood pressure was 162/90. Because 182/90 is hypertensive crisis. 162/90 is stage 2 hypertension. It's still hypertension, but it's a different stage of hypertension. So therefore it would have a different intervention. Hypertensive crisis, I'm probably going to give them hydralazine, IV push. Hypertension, stage 2, I'm probably going to just give them a PO medication. Do you see the difference? I hope that what I'm saying today is hitting to you right now. It's hitting home to you that there are different levels to the same thing. That's why it's not necessarily about knowing as many disease processes as possible. It's more so about your ability to understand the depth and the levels to a very specific group of disease processes. And that's what I go over inside the home study program. So what people do wrong, when people, I studied 1,000 diseases. I went through so many different things, but they still didn't pass their exam. Why? Because their focus was in the wrong place. They're trying to learn so many different things, but they didn't know enough about the same thing. They didn't know enough about diabetes. They didn't know enough about heart failure. They didn't know enough about high blood pressure. So, and I'll tell you, in this program, people who are repeat test takers have passed their exam because now it charges you to focus. It hones in your focus. I remember having one lady, she graduated a few years ago, and she was also from the Philippines. But with her though, after she went through this program, she took her exam When she took her exam the next time, she passed in only 35 minutes and 75 questions. That was it. Why? Because I'm teaching you where to put your focus. I'm teaching you how to really see the task the way the exam wants you to see the task. So I promise you, if you stick to it and you do not give up, you will see your reward. You will finish strong. You will pass your exam. But it's really going to stand based on the details. Here's the last thing I want you to focus on. All right. Once again, all this stuff that I'm going over, it's inside the download, the guide. All right. So make sure that you download the guide if you have not already. Let me put this in here. Let me write this down. So the last one is, what would the exam want me to know? Okay. What would the exam want me to know / focus on? What would the exam want me to know / focus on? Once again, you're trying to think like the NCLEX. So this is part of building your critical thinking skills. Is what would the exam want me to know / focus on? So yes, learn the pathome, learn the signs and symptoms, learn the interventions, learn the drugs. Absolutely. In fact, I would recommend that you learn diseases that way, that you don't just separate it, but as you learn the disease, you learn the treatment at the same time. You learn the drugs at the same time. That way you get into the habit of coupling the disease with the medication. Okay, so what would the exam want me to know / focus on? What is this based on? Safety. It's based on safety. But the problem is that a lot of people don't know what safety looks like. Because many times I'll say, okay, what's the biggest concern, or what's the biggest focus, or what's this? People just say safety, but they're not describing safety though. Okay, so safety looks like being aware of the complications. Complication focus, that's what safety looks like. Safety looks like, what are the potential complications based on what the question is telling me? How do you know the complications? By learning them. By learning them prior to actually being tested on them. When you are learning diseases, you need to know what's the complication that can occur because of this disease. That's the next step to thinking critically. For example, they had a history of MI, a heart attack. What's the complication that they can experience because they had a heart attack? Right? Heart failure. That's the next complication that can occur. They have the history of heart failure. What's the next complication that can occur because of heart failure? Pulmonary edema. So a lot of times, whenever the NCLEX, this is a really good point. I really hope you hear this. Whenever the NCLEX, I'm writing this down, is mentioning a diagnosis and new symptoms, there's a complication. Okay? There's a new complication. Whenever the NCLEX, I'm telling you the truth right now, whenever the NCLEX is telling you a diagnosis and giving you new symptoms, it wants to see that you recognize that there's a new complication, not that you treat based on the old diagnosis. That's where people get it wrong. So a lot of times what people do, they zone in on the wrong thing. So the question will say, okay, you have a patient with history of MI. They came in complaining of shortness of breath. Or even maybe let's say like this. You have a patient who had an MI 12 days ago. And now they're admitted with shortness of breath, and they're complaining that They're complaining that they have difficulty breathing when they're getting up and doing things. Which of the following interventions would the nurse do first? And now what people do wrong is they think, oh, okay, okay, let me see. Maybe we need to give them aspirin. Okay, maybe we need to give them oxygen, right? So they're thinking of answers about MI. When the question is actually talking about a patient who now has heart failure. But they didn't say that in the question. What they said is they gave you the diagnosis and they gave you new symptoms. So therefore, you have to identify that it's a new complication. Here's a huge keyword. Here's a keyword that tells you, oh my goodness, that there's a complication. Sudden, okay, sudden or immediately, okay? Anytime the NCLEX uses that type of language, they suddenly have X symptoms. They immediately have these symptoms. What do we do next? What do we do first? What's the first the nurse would do? What's the priority? Sudden and immediately is indicating something has gotten worse. Something has something has progressed. So you need to treat it based on what the potential progression is. That is how you think more critically. That is how you think more critically. That's how you identify what the exam would want you to know / focus on. Is can you recognize that your patient is deteriorating? Can you recognize your patient now has that their status has changed? That's probably one of the biggest things that the exam wants to see to show that it's safe to give you a license. Is do you recognize that the status of the patient is different, is changed? And if so, what do you do about it? You have a patient who has a history of atrial fibrillation, and they call and say they're all out of medications. They ran out of Coumadin. Which of the following should the nurse, they ran out of Coumadin, but they say they feel fine, they feel like they've been doing better than usual. How should the nurse respond? A, okay, just come in next week for when your next batch is due. B, you need to come in right now and get some more Coumadin. C, describe to me your symptoms, assessment, right? D, why are you on Coumadin, which is a silly question. And you never use why anyways, right? The answer would be, come in right now, you need to get some more. Because if you don't get some more, you're going to be, especially since you're newly diagnosed, you're going to be at risk for developing a clot or a stroke. See the difference? I really hope what I'm saying today is helping you to think more critically and helping you to study differently and study appropriately and correctly to pass the exam. Now imagine if you do all these things. 1, you give yourself an appropriate timeline. 2, you start with your weak areas and the areas that's most concentrated. 3, you create a list of all the content you need to review with, and you reinforce it with questions like in the program. 4, you're consistent and you're consistent and you repeat. You use repetition, reinforcement. 5, you implement diagrams, tables, and visual aids like in the program. 6, you study the differences and how things differentiate. And 7, you look at the progression. You look at what the exam will want you to focus on. You identify the complication. Imagine if you combine all these things I just mentioned together, how can you not pass your exam? How can you not pass your exam? You will be ready. But like I said, you have to be consistent and you have to implement all of these practices. Okay? All right. Oh my goodness. I love today's session. I think today was wonderful. All right. So let me know if you have any questions right now. Now is a wonderful time to ask. Okay. If you have any questions, this is the perfect time to ask. Post your question in the group or below this video, or if you want to think about your question and email me later, then that's fine. I'll be quiet for about 1 minute, and to give anybody who wants to ask a question. Right, and I would say the best place to post your question would be right now in the group. Okay. All right. Okay, I don't see any questions. If you do have a question, like I said, just post it below this video or email me. So I want to make sure I don't miss anybody. Okay. Okay. All right, you guys. Oh, I hope that you found today's session helpful. Please tell me. I want this to be interactive. I really do. So please comment below this video one thing that you learned that you took away from what I said today. All right. Please let me know what is at least one thing that you learned, you took away, or that you're going to implement. Okay. One thing that you learned or that you implement. Yes, I would say I would say yes. You have the homestay program and the 3 days content program. Yeah, I would say that's enough. If you did, what I'll tell you, let me go ahead and stop the mute right now, actually, and stop recording. Okay.
This session is no longer being recorded.
And then we're gonna end this one. Okay. All right. Okay. So I would say for you, Anatasha, it really depends on where you currently stand, but the material in the homestay program and the 3-day program is enough for other people to have passed so like, for example, we've had people who graduated as early as like 8 or 10 years ago, and they were successful with just the homestay program. And then there's some people that use the audio from the 3-day program. So it really depends on you as an individual, but I would give yourself credit that you will do fine with that information. If you're not confident, either take the predictor test or take some type of assessment test, or even the assessment test in the homestay program, and see what your percentage is, and then tell me. So if you score low, like if you score below 60%, if you score below 40%, then that's a red flag. Then you probably need a lot of material. But if you scored below between 40 and below 60, then just go through the program, go through the material that you do have, and then in a few weeks, take the midterm exam and see if your scores are improving. If your scores are not improving, then you'll know, like your practice exam scores, your quiz scores. If they're not improving, then you'll know that you may need more material. But at this time, I would just lean on what you have right now. And then if your practice exam scores do not improve after 4 to 6 weeks, depending on how long you're studying, then you may need more information. But right now, I think you should be fine. Good question. You're welcome. Yes, I remember. It was 68? Okay, then that's pretty good. Natasha, that's pretty good. 60 is actually pretty good. Yeah, that's pretty good. So you should be okay. Just keep supplementing and adding the information that I mentioned throughout this. So if I was you, I would start with the assessment program then, and then the solid steps program, and then the 3-day. Do it in that order. Assessment, solid steps, then 3-day, and then take your test. All right, yeah, so you did pretty good then. Good question. Good question. Okay. Any other questions? And if you do want, if like I said, if you forget, just post it. I look at the, I'll be looking at the group too. If you have other questions and I missed your question. All right. Yay. Okay. Wonderful job, everybody. Listen to this video over and over again. Listen to this video at least twice. Okay. Listen to this video at least twice and then implement what I said. Okay. At least twice, because sometimes you have to hear it more than once for it to register. All right. Okay, you guys. Have a wonderful day. See you next week, same time, same place. And I encourage you to post your questions ahead of time now too, on top of what we're going through, so that way you can, that way I can answer more questions, because I want to answer your questions, all right, about content. I believe next week is you're going to be going over health, motion, and maintenance, but some of you may need to keep, reviewing phasal adaptation. It takes people a long time to go through the second week of the program because there's a lot of videos. All right, guys, that was it. Have a wonderful day. I'll see you next. You learn the different levels of the same thing? Okay, good. Thank you. Thank you. Good, good, good. Good. I'm glad you're going to focus on that. All right. Okay, you guys, I'll see you next week at the same time. All right, bye-bye.